How do we understand the underrepresentation of Black children and families accessing CAMHS, a mixed method qualitative research with professionals and service users? Good morning, good afternoon, good evening, wherever you're joining from around the world. I am Kenesha Jackson, a child and adolescent psychotherapist in doctoral training. The aim of my research is to understand and make sense of the underrepresentation of Black children and families engaging with mental health services. I intend to explore how professionals and service users understand and make sense of the underrepresentation. What are the dynamics between families and professionals during early identification of mental health challenges? I seek to understand how psychotherapy as a discipline can engage more fully with these matters. In this study, I will summarize a recent audit of referrals into a London-based CAMHS clinic to establish the number of referrals received for Black children. During the second phase of the study, in focus groups, service users and professionals shared their experiences. As a Black woman with over 20 years' experience working in diverse communities, supporting children and families in a number of private and public sector settings, primarily from culturally diverse and deprived geographical locations with complex social and emotional needs, I was keen to understand the barriers to accessing support. While I'm aware there may be underrepresentation in other ethnic groups accessing CAMHS, research conducted in 2021 found that Black women in the UK were 4 times more likely to die in pregnancy and childbirth. Black Caribbean pupils 5 times more likely to be excluded from school. Children in the Black community are also more likely to experience adultification, the bias that sees Black children treated as adults and not afforded the same care and compassion as other children. A study conducted in 2020 highlighted that young Black men in London were 19 times more likely to be stopped and searched. Other studies revealed that innocent Black people are 12 times more likely to be wrongly convicted of drug crimes, 7 times more likely to be wrongly convicted of murder, and 3.5 times more likely to be wrongly convicted of sexual assault. They are also 4 times more likely to be detained under the Mental Health Act. These experiences are traumatic for the Black community. However, this community is among those less likely to access CAMHS and therefore even less likely to access psychotherapy. This study intends to produce a document to support professionals in developing their thinking and approach when supporting diverse communities. These are the communities who require specialist CAMHS interventions and services but are currently considered less likely to engage. I plan to explore the barriers to accessing support for marginalized communities, highlighting any blind spots and unconscious bias which may affect sustained engagement. How can the social and emotional needs of members of the Black community be considered? I plan to widen the understanding from referral to successful assessments through to engagement in brief interventions and specialist CAMHS treatment. By highlighting these matters as child and adolescent psychotherapists with knowledge of organizational dynamics, I look forward to effecting change in society and to see more Black families entering consulting rooms should they require support services and treatment. Thank you for listening. I'm Kenesha Jackson.